I've always been interested in why people do what they do, why they behave the way that they behave. I thought that I would become a cultural anthropologist and a university professor, but I actually fell in love with biology after taking an elective course in genetics. Medicine felt like kind of the perfect marriage between science and the humanities. A lot of what we saw in clinical practice were kind of completely preventable illnesses. So we were treating people for things like diabetes or high blood pressure, but we really didn't have the time to, counsel or educate people about the importance of lifestyle or diet or those sorts of things. I was working with a woman who really struggled with severe depression, and she struggled with a lot of physical health issues as well. So she had chronic fatigue and fibromyalgia, chronic pain. So most of her time was spent either in bed or at doctor's appointments. And we had tried every medication imaginable. So we'd gone through the antidepressants, mood stabilizers, we even tried antipsychotic medications, and nothing really seemed to help her symptoms. Imagine my surprise when she comes bouncing into the office and she's bright and smiling and cheerful, and she's like, Dr. Peoples, I feel great. I've been reading all about inflammation, and I've gone on an elimination diet, and I've started taking some supplements to balance my adrenals, and I haven't felt this good in years. So I need you to look over my supplements, because if there are any interactions, I'm letting you know that I'm stopping all of my medications. So she, brings out this grocery bag full of supplements, and I tell her, well, I'll do some research and I'll get back to you. So in kind of doing my research, I discovered the Institute for Functional Medicine's website and really became very curious about how functional medicine can be applied in psychiatry. Seeing a patient who had gone from debilitating depression, not being able to leave her home because she was so fatigued, to being excited and hopeful and enthusiastic about the future was really encouraging for me, because as a psychiatrist, I was starting to get disillusioned because there was only so much that I could offer my patients. Incorporating the functional medicine with psychiatry has really opened up, an entirely new world for patients who may have been told that they're treatment resistant or there's nothing that can be done for their symptoms. My patients are some of the most kind of gifted, brilliant, conscientious people on the planet. And we're all here to make a difference in the world. But unfortunately, things like depression or anxiety can really stand in the way of us being able to really meet our full potential.